some questions. So Maggie, thank you very much for joining us.
Thanks, Katie, and I hope everyone can hear me. I can see in the chat bar some people have been struggling, but please, if you have got any questions, pop them in the chat bar. I'll be more than happy to answer them during this session, or indeed to catch up with people. It was very nice actually seeing everybody join today, because I've seen quite a few names of colleagues that I've worked with in the past, so it's really lovely to be here. And I was absolutely delighted when Katie and her colleagues asked me to be part of this event today, because I'm such a big advocate of this programme, and I'm such a big advocate of the philosophy that underpins it. And I would say I've had the privilege over the last decade of working in some very challenged organisations, and some people question my sanity for doing some of the jobs that I have done, but I can share with you all today just what a privilege my career has been. So I started off my career as a nurse. I celebrate a very big professional birthday next year. I will have done 40 years in the NHS, and I'm really proud of everything that I have been part of during that period, particularly the last couple of years, with the pressures we've all faced with the pandemic. But my pursuit of compassionate leadership started many years ago, well before I really understood the evidence and really the significant impact of running an organisation or being part of an organisation where kindness and compassion was right at the centre of it. It intuitively, to me, felt the right way to behave. And I always say to people, the very best of me is the very worst that I've seen and witnessed in colleagues throughout the 39 years that I've been wearing an NHS badge. But as I got older and wiser in my career, I could actually make those tangible leaps from feeling motivated myself to the impact I could have on my colleagues. And more importantly, I know from my career that when you work in a motivated team, you get great outcomes for patients. Like you, many of you on this call today, you will have two main drivers that make you bounce out of bed. One is to improve things always for the patients, those that use our services. And secondly, your manager and your leaders. And I know in my own career that for some managers that I've worked for, I would always go the extra mile. So swapping off duty, being the organiser of the off duty, you take on more responsibility when those people around you motivate you. And if you do those responsibilities to the very best of your ability, then you start to see great letters from patients and those who use your services. And it becomes a self-fulfilling positive prophecy. And I must admit, over the 40 years I've served, I've bounced out of bed most days. But I also, because I'm a pragmatist and a realist, in those 40 years I've also worked in certain environments which have brought out the very worst of my personality. So those areas where patients are constantly complaining and become the everyday is that you face complaints and you're powerless, or you feel powerless to be able to address them. Start to withdraw. You don't go the extra mile for your patients, and you certainly don't go the extra mile for the managers that you believe are allowing you to work in those kind of environments. Now, the easiest thing for most of us to do is just look for another job, especially when we're junior, because we feel we cannot change the culture or the environment. So for me, as I say, I've worked over a decade now in trusts that have got into the doldrums. And when you start this work, it feels like the elephant is absolutely ginormous. Where do you begin? And that's why the programme, as it's been developed, and it's really lovely to hear of the developments within the programme, because it's responding to the feedback from organisations like mine. The structure that the programme can bring you is exactly where the board and where everybody that works in the organisation should be. So in my last two trusts, when I started, I was told quite clearly, oh, we know what the culture's like round here, it's toxic, or we know what the culture's like round here. You won't get anybody going the extra mile here because it's not the way we behave. it's almost like we know it, so we're just going to move on or just accept it. And perhaps if we put a few more KPIs in about performance, and perhaps if we start making people clock in and clock off, and perhaps if we start being a little bit more punitive, then people might realise that they've got to buck up their ideas. And actually, it's just the complete opposite. And the programme allows you to really start to engage, as Katie said. But really, you know, some of these sound like rhetoric words, but they're not. Really to discover what's happening in your organisation, what makes people think in a certain way, what makes people apathetic, where are those gems in the organisation that are really delivering well. And there's a colleague whose name I saw join this call who did a piece of work for me once in another organisation where it was quite simply triangulated 3 years worth of staff survey data, and they were able to show me areas that had done extremely well one year that crashed the next, areas that had done really badly suddenly improved. And when we started to look at some of the managers, we saw that in one area where they were having significantly poor staff surveys, we moved a superstar from another area and we put them there. And actually over time, we saw that staff survey go up. But where we'd moved the manager who was perhaps not as well skilled, we saw the opposite effect. So you can tell from some of the tools available to you what your organisation is really like. You know, when you're in that discovery phase, you get to talk about culture. What does it mean? And if every single one of us had the time here today just to put a couple of words on a post-it note, I could imagine it'll take us 2 days to actually share, because we've all got a slightly different take on culture, depending on our personal upbringing or our professional training. And it's really important that you decide as a board, or not so much as a board, but as an organisation, what are the elements within culture that mean a lot to us. And I've worked in trusts where there's a lot of similarities, but there's also lots of differences. And you can only really understand that when you spend time exploring it. Now, I remember when Katie came over to the Isle of Wight for me a few years ago now, I really pulled my face, and Katie, you'll remember this. Do we really need to spend all this time going into this? Look, I can give you the staff survey. It says it's quite shocking. But actually, it was Katie's perseverance with us that actually really made this even the more valuable to us. And I do think the opportunity to talk and hear some of your questions is really important as well today, because a lot of what I'm saying I know will resonate with you, but it's just how do you start, how do you unlock it? And how do you, if you're not a chief exec on this call, you might be thinking, well, it's quite easy for Maggie because she can just say it and do it because she's the top of the shop. But actually, it's really important that everybody who's taken the time to come on this call feels that they can have the opportunity to, if we're going to fulfil the people pledges, that your voice matters, and you will get the opportunity to help your board, your senior managers, really shape this programme. Because the other great benefit of following the programme is it gives you that data about your organisation, and your board should look at that information through your sub-board committees, and it's quite compelling when they do see it. You get the opportunity to come together as a board, look at what you've discovered, and design together what you're going to do, what your strategy is going to be, and all those things are really helpful. But the final thing I'd say to you is you will not get results tomorrow. So, you know, the world we live in, people want instant gratification. They want to know, you're doing the programme today, so in the next quarter, will we suddenly see everybody really happy? Will we see the impact of that on patient outcomes, as Michael alluded to? Well, my experience is it doesn't work quite like that. And at times you will feel, oh, is it really worth it? Is it, you know, we're listening to things, we're redoing our values, we've done all of that stuff. But actually, if you persevere with it and you are absolutely determined, you will start to see a difference. I know that because I've lived through it in at least 2 very complex organisations. And I thought I'd just end by reading you out an email that I received on Friday night. So 2 great things happened to my organisation in the last few months. One was our staff survey, and I'm ever so proud and I'm pleased to see the slide that Katie illustrated earlier. We had 60% of our staff fill this staff survey in this year. We buckled the national trend by over 10%. We certainly smashed our previous records. And I'm really proud of the 3 key areas where our staff were saying that they could see the significant areas of improvement, because they were the areas what our staff set as priority. And secondly, we had our CQC inspection last week, because we are a requires improvement organisation. We should have had a visit last May, but because of the pandemic, that was deferred. So, well, there's a long way to go from having verbal feedback to seeing a written report, and I have to be very mindful of what I say, as you will all know from your own trust. Bearing in mind that only a couple of years ago, the CQC feedback, which is public record, says things about this organisation, such as we had 8 core services which were inadequate for safety, and we also had a statement in one of those reports that said this organisation had a blatant disregard for a safety culture. Really hard to read for the staff that work here, but I'm really pleased. I'm going to read you 2 things. One is just a few words that I wrote down on a post-it note from the inspection team, and they said that the inspection team across acute services saw dignified, considerate, bespoke care. There were no patients about whose care the CQC was not confident. I'm sure many of you on this call would really love to get some feedback like that, because I know it's probably made my year. And finally, I just want to read an email that a member of staff sent to me on Friday evening after I'd done a video for staff, just to give them a little bit of that verbal feedback. So obviously I won't name and shame the member of staff, but this member of staff said, I've worked here in this trust for 20 years next month, and I've seen numerous chief execs come and go. I can honestly say that your approach is completely different and a breath of fresh air. You genuinely care about the services we provide our patients and also the staff, who have been seriously overlooked and even oppressed in the past. Working here has sometimes been a huge personal struggle, and I have at times wondered whether the personal cost has been worth it. The lack of respect, professional recognition, and even bullying has been soul destroying over the years, and I've been very close to leaving. When you started, you made a promise that you would change, that the culture in this trust would change, and I hoped rather than believe that that would happen, but you have been completely true to your word. Culture here has changed in the time you've been with us, and the organisation feels like a different place to work. I'll share that not for personal glory, because those of you who do know me on this call will know that I absolutely hate that kind of stuff. I share it with you because when I first came here, I questioned, could I actually do this? Could we do this? But actually, with the support of this programme, it got us going. And once we got going and got our confidence, there was no going back. So I would very, very strongly suggest that if you do want to change your culture, that you follow this approach. And Katie, I'll pass back to you now.
Fabulous. Maggie, thank you so much. I think we've got time for a couple of questions. We got some really interesting questions in the chat. So the first question was, hi Maggie, how did you deal with the colleagues who are resistant?
Well, it's multifactorial, because one size doesn't fit all. So, for example, the blatant disregard to safety culture, we ran human factors training, and I personally did that training about 10 times because I sat with groups doing it. And then when I was doing it, then the manager said, oh, there's no reason for you to do it again, Maggie, I'll do it. So other people then started to step into that space. And actually, when you do human factors training with a group of consultants or a group of clinical staff, oh my gosh, it's light bulb moment after light bulb moment. So we use that. We've also used our appraisal process. So year 1 was just year of have you had your appraisal, because we were so bad here at doing appraisals. Year 2, and then we've had COVID, and now we're back into bringing that to life. Year 2 was all around, has it been a meaningful appraisal? And this year we're evaluating the appraisal. Do we meet the goals that we've set with our staff? We do an awful lot of, we've put a big emphasis on comms and engagement, and we do a lot of videos like with our senior people, and we constantly, I mean, Michael said something, I think, or Katie earlier, about the vision. We bring everything back to those core messages, and many years ago I had the opportunity to talk to Michael, and he asked me how many objectives I'd set for my organisation. And you know, when you think to yourself, there's a right and wrong answer to this. I have no idea. So I said, I think we've probably got about 30 objectives. Michael will smile. And I knew from the look on his face it was the wrong answer. And actually, we were then able to take his very wise counsel and bring that down to a very small group of core objectives, which we've stuck to. So I think education, training, perseverance, and actually bringing all your messages back to your core ones.
Yeah, so that's really interesting. There's something in there, isn't there, about those 5 elements of the model, or the 6 elements of the model: the vision, the objectives, the compassion, reflecting and learning together, and working in teams. There's another great question here, which is, how did you know, Maggie, when things were starting to change? What was the earliest sign that you were turning the corner?
I would say to you the earliest times really is patient satisfaction. So when I first started in these last couple of organisations I've worked, the complaint pile's like that and the compliment pile is like that. And again, anybody wants to come and have a look over here, and we've just been able to show this to the CQC. Our compliments are like this and our complaints are getting smaller. We still get things wrong, and I wouldn't want you to think that I pretend over here that we're utopia general, because we're not. But I think listening to patients, you put your impacts into staff, you will start to see patient outcomes improve. And then there's a whole other lot of indicators as well. So you can look at your pressure ulcers, your falls, your documentation, how well the staff fill that in. There's an awful lot of other subtle changes that you can see, especially if you are using making data count and you start to actually be able to see real trends.
And Maggie, I know you did some work at every level of the organisation, including with the executive team. Are you able to say a little bit about that? Yeah, I think we've gone on, Katie, as well, to develop some of this thinking across our system, because it's very compelling. People say, oh, when we struggle to recruit some of our bands, we're now not struggling to recruit in the same way, although recruitment is our #1 risk over here, like for many other organisations. But we're hearing people say, word of mouth, you know, my neighbour works for you, she said it's got better, my friend's just been in there, it was a better place. And so we've worked across our organisation with the board. There was a board diagnostic, and it's a little bit painful to do because it really is looking in the mirror. You know, you've got 2 ears and 1 mouth for a reason, and it takes you through that. And it's hard, I think, for people, the execs and other senior people. We want to be on a hamster wheel going fast. And actually this programme helps you get off that and really consider. And we've also tried to apply some of the same philosophies, because there's no point us in health solving our recruitment and then social care comes crashing down around us. So trying to do this in a more integrated way. That's fantastic. And there is a question here actually, which I think links in really well, which was, how do you get the message out in such a geographically dispersed set of teams? How do you get the message out to everybody?
So it's good team brief. We have a team brief system now where we did an extraordinary one last Thursday for just to update people on the CQC verbal feedback. I think we had over 388 people at one point on the call. So we've got really good, and our normal team brief gets, I mean, we're an organisation of just shy of 3,000 permanent staff. So, you know, to get 10% of your people on those team briefs, I think is a good sign. We have a lot of networks now which have a very good attendance on them, and we keep the messages really consistent. So we've got emphasised, we've got a director of comms and engagement here. We didn't have that previously. We take it really seriously. Their advice to us as a board is just as important as our nurse, our medical director, etc. So we focused on that. We do an awful lot of this video work because we are 4 services: mental health, community, ambulance and acute. So trying to reach everybody isn't easy. We put a lot on YouTube, and yeah, the staff survey indicates that our staff do feel that we've improved our considerably improved our methods of communication.
Probably just time for one last question, Maggie, which is how long did it take to start seeing things change, which gave you faith in the programme?
Well, we've been doing some work with the National Improvement Team for Emergency Care, and they did a presentation for me maybe a month or so ago. And actually what they could demonstrate on our emergency performance was that we'd actually probably, just prior to the pandemic, so about 18 months ago, we'd started to show a trend of improvement. But of course, none of us really looked at that during the pandemic. We were all really busy just getting on with, especially very isolated island community. It was just survival, really. But now when we look back at that, you can see that the improvements had started 18 months ago, and we've been able to carry them on through the pandemic, like many others. But we've got some statistical significance around that data because we've got good colleagues, haven't we, across NHSE and we've had that support. So I would say to you, this has been a very difficult era with the pandemic to absolutely say for sure. But I reckon 18 months, 2 years is the first indicators that you're getting things right. Another indicator for me was we brought over 125 nurses from the Philippines last year to this trust. Amazing colleagues that have come across during such awful, uncertain times. We've had 100% pass rate with their OSCEs, and that was something this trust had never been able to achieve before. And again, the pastoral support that's required to help people make that transition, the education and the training in the classroom, but also the reception that they had in the wards. So I do genuinely think probably 2 years is a good barometer.
Yeah, thank you. And I do remember that it is just tough. It was really tough going, and I remember just you saying, we're just going to stick with it. We just have faith. And you really did turn it around, Maggie. And as you're talking, there are so many examples of doing things compassionately. So the support for the Philippine nurses, and it is just about dripping this into the organisation in every place that you can, isn't it? And so I just want to make one reflection, actually, which, Maggie, is that for people who lead this kind of change programme, there's something about this combination of having a vision and the humility, no matter how senior you are, which seems to be an important part of this programme. So Maggie, thank you so much for joining us. And I think most people will take this away and will remember it